Now I'd like to introduce our speaker for this morning. Our speaker is Jenna Curcura. She is the Market Operations Manager for DispatchHealth. Take it away, Jenna, and welcome.
Thanks so much, Sue, and thank you guys all for hopping on this morning. So today I'm here to talk to you a little bit more about Valley Health System's partnership with DispatchHealth. So you'll see right here on the front, this is a picture of our rover. So you'll see it says Valley Health System powered by DispatchHealth over on the corner by the gas tank. And you may have seen this car driving around your neighborhood or on the highway. And basically what we do is we provide same day acute care. So we will come to your home and we can do about 70% of what an emergency room can do, or anything that you'd go to urgent care for. So I'm going to kind of go through some of the things that we're able to do and some of our capabilities, and just kind of give you guys a general overview of what we can do here. So DispatchHealth, as I mentioned, we deliver urgent health needs so you can stay home and be safe in your home. So you no longer have to go somewhere where you are in a waiting room or going to the emergency room if it's not necessarily an emergency. So what we do is we provide two professionals that come to your home, an EMT and then a nurse practitioner or physician's assistant. So both of these people are trained in emergency medicine. The nurse practitioner or physician's assistant often come with a background of working in the hospital. And then we also have an on-call ER physician that can be virtually teleconferenced in at any time. The company started in Denver about 6 years ago, and it was actually created by two physicians who felt like individuals were coming into the emergency room, being exposed to germs, coming in, getting a huge bill from an emergency room for things that are not necessarily an emergency. So a lot of our marketing kind of talks about bringing back the house call. So going back to the traditional way where you could be in your home, safe, comfortable, and have somebody come to your home to provide care for you. So we started in Denver, like I mentioned, about 5 years ago, and we are slowly making our way over to the East Coast. So right now we have about 32 markets, and we've been in New Jersey since 2019, and Valley Hospital has been so kind to partner with us. So we've been working very closely with physicians at Valley Hospital, Valley Medical Group, Valley Home Care to provide the best care for everybody. So the next slide you'll see here, this is just a general overview of how exactly this works. So you can request a visit, and we provide either same day or next day visits. And usually when you call, we'll give you a good window. So we like to come and see you between 2 and 4 hours. But what you can do is you can call and request a specific time. We're happy to work with schedules, whether it be you want somebody to be there with you and have somebody come over to join you for the visit, or if you want it to be later on in the day because you have an appointment. Those are all things that we can work with. And when you call to request a visit, the person on the other end of the phone is a medical assistant. So that person takes you through an entire health evaluation to figure out, okay, is it safe for us to come see you, or do you need to go to the emergency room? So for things, I'll kind of talk a little bit more about what exactly are things that we can treat, but for anything that might be an urgent need, such as chest pain or uncontrollable vomiting, things of that nature, we may tell you that it is your best option to go to the emergency room. So that person gives you a full health evaluation and figures out how safe is it for us to come see you and how soon can we be out to your home. We can tell you where exactly our vehicles are located. So we could say, if you call and you live in Wyckoff, we could say, oh, perfect. We have a vehicle in Oakland who's just wrapping up and they can be right over to you within the hour. So that will help you identify when the person can come to your home. So you can either give us a call, or we also have an app. So for your phone, it's just called Dispatch Health, and it's available on the iPhone, Android, and then we also have a website. So you can go right on our website and put in your address and kind of your basic symptoms of what's going on, and then somebody will give you a call to follow up. So then the next step is our team comes to you. So you will get a window when you call. As I mentioned earlier, they are relatively short windows. So it's not like you're waiting for the cable guy or something of that nature where they tell you, oh, anytime between 8 and 8. You'll get a pretty small window. And then the team will also call you when they're about 15 minutes away. So you automatically get a call knowing that the team is on their way. And then we will be able to come and treat you in your home. So I will talk a little bit more about the things that we can do, but we will call in your prescriptions. We will update your primary care physician. We handle all of the billing aspect, which I have some additional information on because I know that it's never fun to get a surprise medical bill. And we actually recently partnered with a company that does prescription delivery. So if you are not feeling well, and let's say the nurse practitioner or PA prescribes you an antibiotic, we can actually call that in for you and have that delivered on the same day. And it doesn't replace your current pharmacy. It's just in those situations where you're not feeling well and may not be feeling well enough to go to the pharmacy, that's something that we could help you with. So now I have just a brief video just to tell you a little bit more about what exactly we do and give you a good idea of what it looks like. So that brief video I just wanted to include in there so you could really get a feel for what it's like to have those two people come into your home. Alrighty, I will go to the next slide. Oops, I'm sorry. Sue just texted me that there was no volume on my video. I am so sorry. I am not sure how I can fix that. However, basically what they were saying was everything that I had just repeated. So you saw the two individuals come into your home. They talked a little bit about how this is much more affordable than going to an urgent care. So, going to an emergency room. So you get billed like an urgent care. So whatever your typical copay is, if you were to go to an urgent care, instead of an emergency room, that's how you get billed. And we are in network with pretty much all the major insurances, including Medicare and Medicare Advantage. Alrighty, so on this slide, I have some things about what exactly we treat. So I won't go through all of these, but I did want to highlight a couple of the major important ones that we see most often. So anywhere from, this one I actually don't think is on here, but we are able to do COVID-19 testing in your home. So we have both rapid tests and also tests that we send out to Valley Hospital's lab. So whichever your preference is, we typically only do the rapid tests if you're feeling symptomatic. And then the next one that I have on here to highlight, dehydration. That's a really big one. So we are able to provide IV fluids right in your home. So instead of having to go to the hospital to get some fluids, we'd be able to sit with you and do that right in your home. The providers do not leave the IV in you. So you sit comfortably on your couch or in your bed, wherever you're comfortable, and obtain those IV fluids, and the providers will sit with you and wait until the IV fluids have come in and make sure that you're feeling better before they remove the IV. We also are able to treat infected wounds or ulcers, or even if you just have a new wound that you're not sure if it's been infected, our team can come out and help you. And that's one of the areas that we work very closely with Valley Home Care, because if Valley Home Care can't get out to see you for the next day or for the next couple of hours, oftentimes we'll come first, and then we'll be able to evaluate and let Valley Home Care know what's going on. Some of the other things that we can see and treat, so the flu or mono, those are actually both two tests that we can actually perform the test right in your home and identify if you have flu, or if you have the flu, or if you have mono, and treat you appropriately. We can also treat UTIs right in the home. So we're able to run and see if there's bacteria in the urine. We can send out a urinalysis. And then we also see a lot of weakness and fatigue. So if you're just not feeling well, you're not sure what's going on, I will talk a little bit more about our kits and what we bring inside the patient's home. But this will help you identify if you're just not feeling yourself, how can we help, and see kind of what's going on with you. And then we do communicate that right back to your doctor. So you'll see here on the left, the picture that I have that kind of looks like a suitcase. So those are our kits. So we have 7 different kits. We don't bring them all into your home. We only bring into your home what's necessary. However, we keep them all in the car. So if something comes up that we didn't originally know, we could always go back to the car and grab something from one of these kits. So the first kit that we have is our lab kit. So we're able to do a blood draw, lab tests, INR, lactate, flu, strep, and pregnancy tests right in the home. We're also able to run a Chem 8, so just taking a look at your chemistries and electrolytes, as well as hemoglobin and hematocrit, and then COVID-19. So that are all the testing that comes in our lab kit. Then we also have a GI and urinary kit, so that we're able to do a urinalysis, a bacteria culture, enemas, insert a catheter if needed, adjust a catheter if something doesn't feel right. Then we have an ENT and respiratory kit. So we carry a nebulizer. We'll be able to perform nebulizer treatments. Right now we are on hold with our nebulizer treatments just due to the COVID-19. It's not considered a safe practice to do a nebulizer treatment in the home right now during this pandemic, but we do have the capabilities. So hopefully as things start to lift, that's something we'll be able to bring back. We're also able to do nasal packing or an eye exam. We have all of the tools in that kit. If you have a scratch in your eye, or if you're just not feeling well, something along with ENT, we'll be able to help you. One of our next kits is the general and ortho kit. So we do carry first dose of many medications on site. So oral medications such as Zofran for nausea or penicillin. So that way, if our nurse practitioner or physician assistant does prescribe you a medication, you'll be able to take your first dose while we're on scenes, while you're waiting for it to be filled or waiting for it to be delivered. The next thing that we have extremity splints, braces, and slings, as well as a knee immobilizer. So if you have a fall and feel like you might have sprained or strained something, we can take a look at that and also provide you with that equipment to properly treat it. Our next kit is a laceration and wound kit. So we're able to do sutures, staples, stitches, bandage up any lacerations. We also carry incision and drainage kits and are able to do a wound culture. So as I mentioned earlier, if something is infected or potentially infected, we're able to do a culture on that and identify if there is an infection there and treat you properly. And then the last one is our IV kit. So we carry IV fluids, as I mentioned before, and IV medications such as steroids, diuretics, and antibiotics. So those are all things that we can provide in the home. And as I mentioned earlier, we would never leave you with an IV in. So we would administer the IV medication, sit with you, let you be comfortable, and while that runs through, when we're finished and when we're about to leave, we would remove the IV. So we would not leave you with an IV in. We do also carry a portable EKG machine. So you'll see that one down there kind of underneath the suitcase, that white machine. It's a little portable EKG. This has been so unbelievably helpful for individuals with cardiac troubles because we're able to perform the EKG and then send that over to your cardiologist or your primary care physician to really identify kind of what's going on and what needs to happen in your further steps. Alrighty. The next thing that I wanted to talk to you guys about is billing. So that's often a pretty big question. So we, as I mentioned earlier, we are billed like an urgent care. So anything that you would typically pay if you were going to some form of urgent care is exactly what you would pay with Dispatch Health. So this is just a good little image just to know. So for an individual who has commercial insurance, typically your copay is somewhere between $44.03. Medicare Advantage is typically around $17.33. Medicare with secondary insurance comes to around $5.44, and Medicare without secondary insurance comes to around $27.31. These are a general average and not an exact quote because it does depend on your insurance. But I've also included the billing department's phone number down there on the bottom. So if you have questions about your specific insurance and you want to make sure that this is something that is in network for you and you want to make sure you're not going to get a surprise bill, feel free to call our billing department and they're very, very helpful. They can take a look, they can run your eligibility and take a look at what exactly you'd be paying for. And we also provide a flat rate for an individual who does not want to go through insurance. That comes to around $275 and then would depend on testing as well. However, we really, really try to encourage individuals that we don't want to surprise anybody with a bill. So we're very, very honest and clear about what's going on. And if there's any kind of testing that's done that maybe something's getting sent to the lab, or maybe we're recommending something else, we're always very clear about how much this is going to cost you, because we don't want anyone to get surprised with a DispatchHealth bill. And if for some reason you are seen by us and you do have a surprise in your bill and this is something you weren't expecting, I highly encourage to call the billing department. Oftentimes they can walk you through what exactly that's charged for, and we can work with you on an operations level as well. The billing department, as I mentioned, is a fantastic resource to have, and it is, instead of, if you were to go to an emergency room, let's say you were going to take the ambulance to the emergency room, that would be a much, much larger bill, especially when it's for something that we can just treat right in your home. I have another video, but I won't play it because I know that my volume's not working. I'm so sorry. I am having a little bit of internet issues this morning, so I don't know if that's what's going on or if it's because I'm sharing a screen. But this individual, this was just a testimonial from somebody who had been seen by DispatchHealth. So she was saying how comfortable it was to have somebody come right into her home. Actually, I believe this one, she was in an assisted living facility. So we were able to come and see her because the rounding physician was not available. So we came out to the assisted living facility. She received IV fluids and she was instantly feeling better. And then she was able to make an appointment with her primary care physician and follow up. So we don't replace a primary care physician. We are basically the exact same thing as if you were to go to an urgent care. So we do a lot of communication with your primary care physician and anyone else who's on your healthcare team, whether that be home health or a gastroenterologist or some other physician. We're happy to communicate with them. In fact, our providers oftentimes over communicate with them. They call them first and say, I just want to let you know, I'm going to see your patient, Jenna Curcura. This is what's going on with her. I'll send you notes afterward. And we really do provide a very much team approach to your healthcare. We want to make sure that you're getting the best care possible. Alrighty, and then my next slide, I just went through some frequently asked questions, some questions that people often ask. So the first one is something that I just touched on. Does DispatchHealth replace my primary doctor or home health agency? No, we're not a home health agency and we're not a primary care physician. So we work in supplement to those individuals. So a lot of times, as I mentioned, we work with Valley Home Care, we work with primary care physicians to make sure that you're getting the best care possible. If you're receiving home health and let's just say they can't come see you until Monday, we're happy to come see you on a Sunday and make sure that everything's okay and make sure you have all of your medications and you're comfortable. We are open 365 days a year, and typically a lot of crazy things can happen when it's a holiday and you really don't want to go to the emergency room. So on Thanksgiving, when something happens, you can call us instead of going to the emergency room on a holiday, which has really helped a lot of people. And we are open from 8 a.m. to 10 p.m. So not 24 hours just yet, but if you had a fall in the middle of the night and were feeling okay and got back into bed, but just wanted to be checked out in the morning, that's something we could help you with. The next question that I have here is, how do I know if I should go to the hospital or if I should call DispatchHealth? So we always recommend going to the hospital if it is an emergent matter. If you are uncontrollably bleeding, if you are uncontrollably vomiting, if you are feeling very, very ill and you think you need to go to the emergency room, I would highly recommend it. Chest pain. However, if you're in a situation where you're unsure, is this really an emergency? Should I go to the emergency room or should I call DispatchHealth? You can feel free to call us. The health evaluation with the medical assistants that are answering the phone will help you identify, is it safe for us to come see you or should you go to the emergency room? The next question, what if the team arrives and they decide that I need to go to the hospital? Yes, unfortunately, this happens. So sometimes the team will arrive and when taking vitals, they will identify that your vitals are elevated and you need to go to the hospital. When that happens, we call the ambulance and we will wait for you. We will wait with you until the ambulance arrives and make sure that you're comfortable in getting into the ambulance and going to the hospital. We will never just up and leave. We wait until last possible second and hand you over to the EMS team and make sure that you are comfortable. How do I get my test results? So with anything that gets sent to the lab, they will call you within the next couple of days when the results are there. And we also have the ability to have a patient portal. So if you have somebody that would like to see the portal, whether it be yourself or your son or daughter or your sister, we are able to provide access to the portal. We would just need permission from you. So that way you can easily go on and download your results and keep them in your personal files. But you also will get a call. And if when the team calls you, you decide that you would like a hard copy, we're happy to mail you a hard copy as well. So we're very, very willing to work with everyone and make sure that they can get all of their results in the best possible way. The next question, what if I need an x-ray? So we actually do work with a company called Mobile X or Trident Care, and they can provide imaging in your home. And we actually just recently acquired another company that we will soon have the ability to do the x-ray and the ultrasound and things of that nature right in your home, right during your visit. With Mobile X or Trident Care, we do actually have to schedule it. So it might be later on in the day or it might be the next day, but we are happy to help accommodate you to make sure that you can get the proper imaging that you need. COVID-19 test, I know I touched on this before. So we are doing COVID-19 tests. We do both PCR tests and rapids. So depending on what you need, depending on your symptoms, we're happy to help in that case. If you live in a senior community, we are also happy to come and see you. So in an assisted living or in an independent living, we see a lot of different people and are happy to come. And then I also wanted to mention, we actually do see anybody over the age of 3 months old. So if you have a neighbor or you have somebody else that might need to be seen, this has been really helpful when a small child needs stitches or staples or something of that nature, instead of bringing them to the emergency room and causing a lot of trauma and fearfulness. It's able to have a friendly face come right into your home. The next one is, why does the team ask for my credit card when I call for an appointment? This is something that happens frequently. So the team does ask you for your credit card for a copay. However, if you know that you don't have a copay or you prefer to be billed later on, feel free to say that. Just say, I would like to receive a paper bill instead of putting my credit card over the phone, and that's not a problem. That's just something that is in their script, and it really depends on individual preference. So I did want to address that and make sure that everybody knew that that's okay. You don't need to give your credit card at that moment. And that's pretty much all I have, but I would love to hear, Sue, if you want to pass over any questions that came through in the Q&A or any questions that came through in the chat, and I'd be happy to answer them.
Oh, thanks so much, Jenna. It was so informative. So somebody had asked, will whoever is visiting the nurse contact your primary care doctor while they're at your home if it's necessary?
Yes, absolutely. So oftentimes we will end up calling right even before we go and just say, hi, I'm going to see Mrs. Smith and she is vomiting. I just want to let you know what's going on. Is this typical? And a lot of times it is very much a team effort with the primary care physician. However, during your onboarding process, you also have the option to say, I would not like you to contact my primary care, which is okay too. It's completely up to individual preference.
Oh, great. And also our 8 a.m. to 10 p.m., the call center hours or the visiting hours?
So those are the visiting hours.
Okay.
The call center is open from 6 a.m. to midnight. So you can call within those outside hours. And then if you also wanted to put in a mobile request or a web request, we'll call first thing as soon as the call center opens. So if it's in that kind of outside of those hours, we're happy to call right when we open.
So what would be the best way to contact Dispatch Health? Is it through you want to provide information, or is there a phone number or particular?
Yeah, sure. I can, let me get the best phone number. And I also wanted to mention, I'm sure that most people are in Bergen and Passaic counties, but we also cover Morris, Essex, Union, and Hudson counties in New Jersey. So if you know anybody who's in those counties and needs care. So we do have 2 different phone numbers. However, it doesn't matter which one you call. So sometimes it's a 973 number that comes up. Sometimes it's a 201 number. We just do it so it's more relatable. So the best phone number to call is 201-882-7526.
Okay, so everyone get that? All right, terrific. And as far as any COVID restrictions or issues with that, is there any commentary on that or?
No, so we are able to see COVID-19 positive patients. So if you unfortunately have COVID-19 and are feeling dehydrated or just not feeling quite right and feel like your symptoms should be resolving, we're happy to come see you. Our team does come in full PPE and everything that we use is individually wrapped. So everything is just for just for your use. We're not reusing anything. And we also throw away all trash on scene. So our cars are not getting germs passed from house to house. And our cars are also, they're sanitized. Sorry, blanking on that word. They're sanitized every morning at 6 a.m. Actually through the Urban Auto Spa. So they are freshly sanitized, and then everyone is in full PPE at all times. So even the two providers, when they're in the car together, they're in masks and everything to avoid the spread of COVID-19.
Oh, thank you so much, Jenna. That was wonderful, so comprehensive, excellent information. So